Right now, more than 11 million adults in this country are walking around with diabetes and they have no idea. Not because they weren't paying attention, not because they don't care about their health, but because the early signs of diabetes rarely look like an emergency. They look like being a little more tired than usual. They look like getting up one more time at night to use the bathroom. They look like a cut on your foot that is just taking a sweet time to heal. As a physician, I've taken care of patients who came into the hospital for something else entirely, like a knee replacement, a bad case of pneumonia, and that's when we discovered their blood sugar had been quietly climbing up for years. In some of these cases, the signs have been there all along, they just hadn't been connected to one another. So, in this video, I'm walking you through 7 early signs of diabetes that most people brush off. And I'm explaining why your body produces each one and telling you exactly when it's time to ask your doctor for testing. Stay with me until the end so you don't miss out on any of these important signs. Hi, I'm Dr. Bernard. I'm a board certified internal medicine physician. And as always, please know that this video is for educational purposes only and is not a substitute for medical advice. Please talk to your own healthcare provider about your individual risk and any testing that may be right for you. So let's get into it. According to the Centers for Disease Control and Prevention, CDC, over 40 million Americans are living with diabetes, and roughly 11 million of them are undiagnosed. On top of that, more than 115 million adults in the United States have prediabetes, and the CDC estimates that about 8 out of 10 of them don't even know it. That number stops me every time I say it loud. Type 2 diabetes typically develops gradually, sometimes over several years, which means your blood sugar can be elevated long before you ever feel sick. That's exactly why these 7 signs matter so much. They are your body's early paperwork that is filed long before the diagnosis ever shows up on the charts. None of these signs are dramatic on their own. That's precisely what makes them so easy to explain away with, like a busy schedule, a stressful season, or simply getting older. So now let's run through these signs. Sign number 1, frequent urination, especially at night, particularly if you are waking up multiple times at night to go. Here's what's happening inside your body. When your blood sugar rises above a certain level, your kidneys can't reabsorb all of that sugar back into your bloodstream. So they do the next best thing. They pull out extra water out of your blood to flush that excess sugar out through your urine. The medical term for this is called polyuria, and it's one of the most classic early markers of high blood sugar. Most people just blame this as drinking more water before they go to bed, getting older, or a small bladder. Sometimes that's exactly what it is. But if you notice you're waking up 2, 3, or more times a night to urinate, and this is a new pattern for you, then that's what mentioning to your doctor. Don't just blame it for other things. And it's also worth noticing what that interrupted sleep is doing to the rest of your day. Because broken sleep and daytime fatigue, they often travel together. Sign number 2, thirst that water doesn't seem to fix. And this second sign is directly connected to the first, and that's persistent thirst. Since your body is losing extra fluid through more frequent urination, you naturally become dehydrated. Your brain responds to that dehydration the only way it knows how to, and that's by triggering thirst. So you drink more water, which feels like the responsible thing to do, and for a little while it helps. But then you're thirsty again within the hour. This cycle, frequent urination followed by intense thirst, followed by more urination, is one of the oldest recognized patterns in diabetes. So if you find yourself carrying a water bottle everywhere and still feeling like your mouth is dry, no matter how much you drink, that's not just a hydration habit, that's your body sending you a signal. Sign number 3, exhaustion that sleep doesn't fix. This third sign is fatigue, but a very specific kind of fatigue. It's not the tired you feel after a late night, but the tired that is still there after 8 hours of sleep. Here's the mechanism. Glucose is your body's primary fuel, but it can't power your cells on its own. It needs insulin to unlock the door and let the glucose go inside. But when your cells become resistant to insulin, which is the hallmark of type 2 diabetes, glucose stays trapped in your bloodstream instead of reaching into your muscles and organs where it's needed. So even though your blood sugar might be technically high, your cells are running on empty because the glucose is not getting into your cells. It's like sitting in a car with a full gas tank, except that the fuel line is blocked. So that disconnect between having plenty of sugar in your blood and your cells actually being starved for energy is a big part of why fatigue shows up so early, often before someone even gets a formal diagnosis of diabetes. Now, I want to be clear about fatigue because fatigue has many causes, and I'm not asking you to panic over one tired week. I'm asking you to notice a pattern of exhaustion that doesn't improve no matter how much you get some rest. Sign 4. This is blurry vision that comes and goes. And this sign catches people off guard because it can be intermittent. It might show up for a few days and seem to resolve on its own, which makes it easy to dismiss. When blood sugar rises, fluid can shift in and out of the lens of your eyes, and this temporarily changes its shape. The change in shape affects how light focuses on your retina, and the result is blurry vision that has nothing to do with needing new eyeglasses prescription. Some patients get their eyes checked, they even get new glasses, and they still feel frustrated because their vision just kept fluctuating. So if your vision is changing from week to week rather than staying consistently blurry, and especially if it's paired with any of the other signs on this list, that's a pattern worth bringing up at your next appointment. Sign number 5. This is slower wound healing along with infections that seem to keep coming back. High blood sugar can damage small vessels over time, and those vessels are responsible for delivering oxygen and nutrients to injured tissue to help the tissue heal. So when circulation to a wound is compromised, healing simply takes longer than it should. On top of that, elevated blood sugar can impair how well your white blood cells function. And these white blood cells are the cells your immune system depends on to fight off bacteria. That's part of why urinary tract infection, yeast infection, and gum infections tend to show up more often and they take longer to clear in people with undiagnosed diabetes. So if you've noticed that a small cut or scrap that used to heal like in a week is now taking 2 or 3 weeks, or you're dealing with your 3rd urinary tract infection this year, please don't just treat the infection and move on. Ask what might be driving this pattern. Sign number 6. This is tingling or numbness in your hands and feet. And I want you to really pay attention to this because this is the one most people wait far too long to mention. This tingling, numbness, and burning sometimes usually starts in the feet and moves up into the hands. Prolonged elevated blood sugar can gradually damage the nerves, particularly the smaller nerves farthest from your spinal cord, which is why your feet are often affected first. This condition is called peripheral neuropathy. And here's the part that concerns me the most as a doctor. By the time the nerve symptoms appear, blood sugar has often been elevated for a longer stretch of time than people realize. Patients describe this symptom in so many different ways. Some say their feet feel different. Some say it's like walking on a thin layer of static. Some report pinprick sensation, in their hands or in their feet. And some say their socks feel bunched up even when they are not. All of those descriptions deserve a conversation with your doctor, not a shrug and a new pair of shoes. The reason I'm pressing on this one so hard is that nerve damage from prolonged high blood sugar is not easily reversible once it progresses. So catching it early is what protects your ability to feel your feet clearly for the rest of your life. Because I've come across patients that even after they start taking care of their diabetes, but had already developed nerve damage, they still keep having the numbness, the tingling. So it's something that it's not so easy to reverse once it starts developed. So catching diabetes early before nerve damage develops definitely is protective. Sign number 7. This is dark, velvety patches of skin. This is a skin change called acanthosis nigricans. It shows up as dark, thickened, velvety patches of skin, most often on the back of the neck, in the armpits, or in body folds. This happens because elevated insulin levels in the blood can stimulate skin cells to multiply faster than normal. And those new cells often carry extra pigment. This results in the darkened, velvety texture that you can actually see and feel. Acanthosis nigricans doesn't hurt and it's not dangerous on its own, which is exactly why it's so easy to overlook or mistake for a skincare issue. But this skin change is one of the more reliable visible clues that your body may be producing extra insulin to compensate for insulin resistance. And it can appear before blood sugar numbers are officially in the diabetic range. So if you notice these patches on your own skin, that's not a cosmetic issue to cover up. That's a conversation to start with your doctor. So when should you actually get tested? Because knowing the signs only helps if you know when to act on them. The American Diabetes Association recommends screening for prediabetes and type 2 diabetes should begin at age 35 for most adults. But that age gets moved up if you carry additional risk factors. And this is where I want you to really listen. If you have overweight or obesity, combined with even one other risk factor, then testing is recommended regardless of your age. You don't have to wait till you're 35. The other additional risk factors include parents or sibling with diabetes, high blood pressure, a history of gestational diabetes, polycystic ovary syndrome, or belonging to a population at higher statistical risk, including Blacks, Hispanic, Native Americans, Asian American, and Pacific Islander communities. If any of the 7 signs we just talked about are new for you, don't wait for your next annual physical to roll around. Call and ask for blood sugar testing sooner. The testing itself is simple. It's usually a fasting blood glucose test or an A1C test, which measures your average blood sugar over roughly the past 3 months. Sometimes your doctor will use both of them, either the fasting blood sugar or the A1C. These are quick blood draws, not complicated procedures, and the information they give you is worth far more than 10 minutes it takes. Most insurance plans, including Medicare and Medicaid, they cover diabetes and pre-diabetes screening as preventative services. So cost is rarely the barrier for quite a number of people. The real barrier in many people is usually just picking up the phone and making the appointment with their doctor. According to the American Diabetes Association, a normal A1C falls below 5.7%, and between 5.7% and 6.4% is classified as pre-diabetes, and 6.5% or higher, confirmed on repeated testing, meets the criteria for a diagnosis of diabetes. Here's the piece I want you to walk away with. Catching pre-diabetes early gives you the single greatest amount of control you will ever have over this condition. Research has shown that structured lifestyle changes, things like modest weight loss and regular physical activity, can significantly reduce the risk of prediabetes progressing to full type 2 diabetes. That window of opportunity is real, but it only stays open if you act while it's still open. So none of these 7 signs on their own mean that you definitely have diabetes, but together, they are your body's way of asking you to pay attention. And paying attention early is so much easier than managing complications later. So here's what I want you to do. Think back over the last few months. Has anything on this list felt familiar? If even one of these has been sitting in the back of your mind, that's your sign to schedule the appointment. Tell me in the comments which of these 7 signs surprised you the most. And if you found this video helpful, please share it with someone in your life who needs to hear it. It might be the nudge that gets them tested. And hit the subscribe button and like the video so you don't miss out on more of my educational videos. Take care of yourself and I'll see you in the next one.